Alrighty, here we go. Again, welcome. Thank you for joining us today on this very hot day in Texas in June. Uh, got a little change of course today, so we're gonna make sure I got this down in my brain. First off, if you've never seen all of our beautiful faces, here we are. And there's so many of us, we take up 2 pages now. So here's the team as it stands today. We do have some more coming soon, so there will be updates to this next time we see y'all. Now for my favorite part, let me know where you're coming from. So on the left side to your map, you'll see your drawing tools. You can use a pen, you can use a shape. Let me know where you are coming from today.
Craig, I'm not sure what happened, but we got moved off of that.
I know. Hiding the cameras for now. There we go. Play with the map, y'all. Play with the map. All right, East Valley. Any Lubbock or Abilene today? Midland, Odessa? Where are you at? Where are you at? Beaumont? We got any Beaumont today? Nice. Nice smiley face. Good artistic value there. All right, well, we do have a full agenda, so let's go ahead and get into the next section. I'm going to hand it over to Margaret. Margaret, you want to activate your camera again, and let's get our intro done.
Oh, hi everybody, and welcome to the June 8th Texas Balance of State CoC General Member Meeting. My name is Margaret Hill. I'm the Governance Coordinator for the TXBOS CoC, and again, thank you for coming here today. We're so glad to have you here. So, actually, how do I go to the next slide? There we go. So this is going to be a meeting for the Texas Balance of State, CoC, which we sometimes abbreviate to TXBOS CoC. I have here a map of all of the CoCs in Texas. There are 11 of them, and the Texas Balance of State is the largest. It's all of this orange you see here. It's 215 counties. So we have quite a large area we're working with. The mission statement of the CoC is to develop system-level responses and coordinate local community strategies that end homelessness and increase housing stability. And we do encourage anybody who lives and or works in the CoC to attend these meetings, although the information is probably going to be mostly relevant to people who work within home services in this area. And specifically also to like people who are more like on the kind of program manager level. But again, we encourage anybody to be here, and everybody is welcome if they would like to learn more about the work we're doing at the Texas Balance of State. And you know, we're always changing the content, so it's likely that different meetings are going to be relevant to different people. So please keep attending if you are looking for more information. Oh, and it looks like my links have become invisible on the slide somehow, which is strange. But basically, you can find more info about us on our website, about Texas Homeless Network. Our website's thn.org. Although it looks like the link's still working if you click on it, but it's just not visible. You can also sign up for our newsletter. That always has lots of really good information and opportunities in it. And also, we are going to have an orientation for people who are newer to the CoC. This is a new thing we're doing. It's going to be on June 15th from 2 to 3 p.m. I can get the registration link put in the chat here in a second. But if you aren't as familiar with the CoC, or if you know people who you think would benefit from some more basic information, we definitely encourage you to attend and invite other people. And lastly, if you are new to our meetings, we have a pod here. This is today's material that has all the materials from this meeting that you can download and view separately on your own computer if you need to. And also, these materials will be available on our website, again, thn.org, and they'll also be sent out to you after the meeting as an attendee. So again, thank you for being here, and we really appreciate you taking the time out of your day. And I will pass over to Kira Anderson, or Kira, our Director of Systems Change, and our Data Coordinator, Alex Paradis.
All right, hello everybody. My name is Alex. I am the data coordinator here at THN. So we're going to be talking about our 2022 point in time data. So before we get into this year's data, I want to talk a bit about some of the major factors that have affected this year's pit count. Biggest factor, of course, which is, the kind of like the elephant in the room, is COVID-19, which has kind of, affected our ability to get people to both participate and get people to gather the data, because the danger of the virus poses. Excuse me, I'm so sorry, I can't talk today. There's a danger that the virus poses to both people experiencing homelessness and those who gather data. So we stress usually that the point-in-time count is going to be an undercount, and we want to stress this even further this year because COVID has impacted our ability to comprehensively survey the balance of state CoC. So I also want to mention that this year we had 2 separate count dates due to COVID-19, and that is something to keep in mind as well. So on a normal pandemic-free year, we would typically gather data on the last 10 nights in January, which are usually the coldest nights of the year. And this year we had 1 count in January and 1 count in February. So that's something that I want us to keep in mind as we go through this data. So with all that being said, let's go ahead and get into our results. So as you can see here in this lovely, lovely infographic here, we had 7,054 individuals experiencing homelessness on a single night in 2022. So roughly half were sheltered, and the other half were unsheltered. So 40% of our respondents were Hispanic or Latinx, which is nominal and consistent with the percentage of Hispanic and Latinx people within our CoC, according to the U.S. Census. However, we did observe racial disparities, as 22% of people experiencing homelessness within our geography were Black or African American, even though that particular demographic only makes up about 8% of our geography's total population, again, according to the United States Census. So 1,108 were children between the ages of 0 to 17. There were 554 youth between the ages of 18 to 24, of which 80% of them were unaccompanied on the night of the count, which means that they are without parents or guardians, and 5,392 adults over the age of 25. Out of those who were over the age of 18, 8% of them were veterans experiencing homelessness, and 15% of them were survivors of domestic violence. So of those surveyed, we also found 17% of people who were asked if they had a mental illness responded yes, and we also counted 1,141 chronically homeless folks, which is about 19% of people over the age of 18. So I'm going to quickly link something in the chat in case you are interested in... Is it cutting out? Can you all hear me?
I'm hearing you fine.
Okay. I was just saying, I'm going to link... Okay. I was just going to link something in case you're wondering how HUD defines chronically homeless in the chat real quick. So like we mentioned before, when you're comparing things, it's important to keep in mind that this is the first year since 2020 that we've been able to complete both a sheltered and an unsheltered count. In 2021, we were only able to complete a survey of sheltered individuals. Even with that in mind, it's important to also note that the sheltered numbers for 2021 are going to also be a significant undercount, because that survey was also conducted during a very severe moment of the pandemic, similar to how this year, 2022, our survey was conducted during a surge of one of the variants. So, in addition, the 2020 pit count was also conducted prior to the pandemic. So, we recommend that comparisons between years be made sparingly and strategically. And also, if you're wondering what we mean by that, I'm going to quickly, again, link something in the chat. It is our webinar that we conducted about a couple weeks ago, I think, basically on how to read your pit data and how to kind of put that data in context with past pit count results. So it provides some basic info on how to analyze it and compare it to previous years. All right, so we're going to launch some polls really quickly. We really want to hear from and get some feedback on what y'all think about this data. So I think the first prompting question is going to show up. All right, so our first prompting question is, what about this data surprises you or confuses you?
Also, there is no submit button. You just hit enter once you've typed in your answer.
Also, we want to quickly note that y'all intentionally don't have access to your chat right now. So if you have questions or anything you want to add, please pop those into the third question box so that Alex can help address those.
Yeah, absolutely. I'm starting to see some responses actually. So I have one that says the number of unchecked homeless. Yeah, for sure. This year in particular, like I mentioned, like the factor of COVID-19 has kind of made it difficult for both people wanting to respond to our survey and also recruiting people to actually go out there and gather data. All right, we also have another. Are they all three appearing at the same time?
Yes, all three are
Sure.
live right now.
Okay, so our other questions that we want to hear from y'all, what data do you wish was on this graphic? And what questions do you have about this graphic? All right, I'm seeing some answers for what data do you wish was on this graphic. I see one that says racial disparities other than for people that are Black or African American. See someone ask for some more information on people who are chronically homeless. I definitely think that's something to consider. See one that says comparisons to other CoCs. Percentage identifying mental illness or mental health issues. Yeah, I think that's also another great suggestion, having percentages for each of our subpopulations that we account for on our PIT surveys. An urban and rural breakdown. The numbers for communities more than 250,000 and below. These are all great suggestions, and towards the end of June, we're going to be releasing a blog post and a new and improved infographic. So all these suggestions are very, very valuable to me, and definitely a lot of things that y'all are saying I'm absolutely going to consider, especially when we're talking about our subpopulations. Elderly data, that's a good one. Maybe like an age breakdown. I don't see any questions about the graphic.
I think the only thing that might be a question, but more of a confusion point, I'm seeing in the first area where it says veterans are 6% of the population and 8% of the homeless. So I just want to clarify that point just in case I'm reading it just in case I'm reading it a particular way. The reason that veterans are 8%, so if you were to do the veterans divided by the total number of people, that technically wouldn't be accurate because kiddos can't be veterans. So if if the person who wrote veterans are 6%, but 8% of the homeless population, what we're citing there is that they're 8% of the people who are eligible to be veterans. So I just want to clarify that one point in case that was a confusion.
Alrighty, well, thank y'all so much for your input on this infographic, and it was really awesome to hear what y'all think about this data. We're going to have to move on with our presentation, but I'm going to still be in the chat responding to any questions that y'all might have. And also, if you have any other questions, input, or feedback regarding this data set, please email me at alex@thn.com, and I will be in touch with you. Yeah, with that being said, again, thank you all for your input. Be on the lookout for that blog post and that new infographic towards the end of this month. I'm going to go ahead and pass it off to our next presenter. Thank you all very much.
All right. Hello, everyone. This is Mary Stalkey. I'm the Director of Engagement for the Texas Balance of State Continuum of Care. And I want to introduce briefly our next speakers. They are from a project called Be Well, Texas. And their names are Carla Ramirez. She's the director of the project, and Briseida Courtois, who works in the project. And I will turn it over to you two to further introduce yourselves and tell us more about the Be Well Texas project.
Briselda and Carla, you'll need to activate your mics at the top.
Hello, can y'all hear me? I'm sorry about that.
There you go. Yes, we can hear you.
Oh, great. Hi, my name's Carla Ramirez, and I'm the director for Be Well Texas here at UT Health San Antonio. And thank you for having us. No, I don't know if B has figured out how to do the. She might not have figured out how to do the microphone. That's okay. Briseida Courtois, she works with us. She's a program manager, and she's over one of our programs called Provider Network. And she's here today to talk to you guys as well because she is over the part that we will be talking about where we can fund providers to provide care throughout the state of Texas. Do I have, oh, there we go. I didn't know that I had control over my, so it was kind of interesting that you guys showed that point in time data because I was surprised by the number of behavioral health, people struggling with mental health and substance use disorder issues that were identified there. Here she is.
Hello, sorry, I was having technical difficulties, I guess, trying to maneuver. I think this is the first time, I know this is the first time I used this Adobe Connect, so I was still struggling. So I just ran over to Carla's office. My apologies. Good afternoon. My name is Briseida or B. Courtois. I am one of the program managers with Be Well Texas, and I work directly with the provider network, which means I work with the providers that we contract with across the state of Texas. Thank you for having us.
Okay, great. So here's just some data that kind of supports the fact that substance use disorder has really created quite a significant public health issue in our state. If you notice, 1 in 10 people in Texas meet criteria for a substance use disorder, which is pretty high. And drug overdose is the leading cause of maternal deaths in Texas. I don't know if you guys knew that, but it's a pretty shocking number. And we've had a very high rate of overdose deaths in the last year related to COVID. The country as a whole had over 100,000, and we had, I think it was closer to 5,000 drug overdose deaths at this point. So the numbers keep rising despite all of the resources that are being put into services. So how does substance use disorder intersect with housing, right? And I'm sure I'm preaching to the choir here. But of course, the same issues that you guys deal with your population are the same issues that we deal with. And so most of the individuals that we work with have substance use issues, and they also may have housing insecurity. They may have mental health issues. They may be veterans. They definitely tend to have a higher rate of comorbid physical health conditions and more interaction with the criminal justice system. And of course, trauma. So, what is our mission? Our mission is to provide equitable access to compassionate, evidence-based care and services for people who use substances and those with substance use disorders. And we do this through funding that we receive through the state and through the federal government. And some of the kind of main areas that we focus on are people with lived experience, so peer recovery support, addiction medicine, our provider network, and utilizing health informatics and technology to improve outcomes. I'm sorry about my throat. So if you look at our initiatives, we have quite a few different ones. And we have a provider network, like we mentioned before, that really is focused on helping providers increase their capacity to provide services to folks that don't have the means to be able to pay for it, right? So this is funding for indigent populations, people that are 200% under the federal poverty guidelines. And so our provider network consists of substance use disorder treatment providers, mental health authorities, hospital networks, peer recovery support services, and many different types of services available to kind of ensure that folks can get the support they need to have better outcomes. Part of our peer recovery support services includes utilizing technology to enhance our ability to reach folks that maybe are in rural areas or in difficult areas to reach, or also utilize them in different ways, maybe in emergency departments and things like that. We have our disaster response project, which is really focused on creating an emergency response system for substance use disorder for people that are impacted by disasters, pandemics, different types of things like that. We have our clinic, which is the thing that mostly I'm hoping you guys will be interested in, which is a virtual solution to fill gaps in areas where there is no treatment available. And we're able to provide evidence-based treatment through our clinic virtually to people all over the state. And we have ways to get the medication to the patients. We have ways to do drug screening. And we're able to do all of this remotely and in a safe way, and guaranteeing that the people are going to get really good care. And we have a telementoring project, or a center actually. And what that means is we have a whole department that focuses on educating communities and providers and different groups to improve their capacity to kind of do this themselves. So we have what are called ECHOs, which are community of practice networks. And what those are is they're a way to have a little bit of didactic training from an expert, but then mostly it's really consultation on cases that actual providers are having. So if we go into a community that needs more providers, we can help train those providers up and provide the consultation that they might need to feel more comfortable. And then while they're doing that, we can fill the gaps with provider network or with our clinic until they're able to, fill the needs in their communities themselves. Here's a map of our provider network, and it kind of shows you where the areas where we have different types of providers, and you'll see we have the different categories: medication-assisted treatment, recovery housing, screening and referral to treatment. And also you'll see the areas where we have just nothing. And so those are the areas that we're really trying to focus on, finding solutions for and ways to enhance the needs of the people that live in some of those areas that are still very high risk. I did want to throw out just one of our projects because it does specifically relate to housing. We just rolled out a recovery housing project for emerging adults, and it's for ages 18 to 25, and it's for folks that are in recovery, and it's called level 2 and level 3 housing. And so what that means is those are a little bit higher levels of care, if you will, for recovery housing, meaning that they have peers in recovery that are staffed there and helps provide more oversight than a level 1. So our telehealth services. So like I said before, we have our Be Well Texas Clinic. It's free. Anyone can access it. We really aim for same day, next day appointments. And we provide both substance use disorder treatment and related non-severe mental illness and physical health treatment. So if we have somebody that comes in with an opiate use disorder, but maybe they also have anxiety and high blood pressure, we have the capacity to address all those things instead of sending them to 3 different providers. We have recoverytexas.org, which is an option for people that are not really sure what they want. And it's a way to go online and access immediately peer recovery support on demand, and also to take a self-assessment to see, maybe somebody's wondering, well, am I drinking too much? Am I using too much? They can take an evidence-based screening tool that will score out and make recommendations. They can also access the clinic this way. They can access other resources like recovery, yoga, different meetings and things like that. So it's a great resource for people that maybe aren't ready for treatment. And then, of course, our digital health services, we have ways to incentivize people to stay engaged in treatment. One of the ones that I particularly like is a contingency management program where people can earn Amazon dollars by participating and staying engaged in their treatment plan. And so it's a way to kind of enhance their outcomes and also have them identify other things besides just going to counseling, taking their medication, but things like, participating in a social activity or self-care or things like that they can also earn Amazon dollars for. So these are the services that the clinic provides. We have 4 board-certified addiction medicine physicians and several other psychiatric nurse practitioners available to do medication management. We have quite a large team of LCSWs and LPCs to do counseling. We have peer recovery support services available, and then we have case management services as well. I was asked to provide some data, some outcomes, and our clinic opened in October, so we don't have a lot of clinical outcomes yet. We should have them by the end of the year, but here's just a little idea of like our payer mix and the number served and things like that. So since October, we've served 2,005 people, and I would say our payer mix is about 60% unfunded, 40% funded. And these are the organizations that tend to refer most to us. This just talks about recoverytexas.org. And like I said before, it's just a way to provide somewhere for people to go that aren't sure. We have thousands of socks that have this on them and lighters that we want to donate to different providers as a way to do outreach. And so people can have the website on them and available to them should they choose to use it. And here's all of our partners. It takes the village, and we couldn't do this without our partners. And we would love to engage in discussions to partner with you guys as well, and hopefully meet the needs of the populations that you serve.
Carla, did you want to go over your 2 brochures, or did you just want that as supplemental material?
It's just supplemental. The 2 brochures are just our collateral, and it's just more information that one of them is patient or client facing, and one of them is more for providers or people that are going to refer. And we have those available also in paper format. If anybody wanted us to send them, we'd be happy to. But it just kind of describes our program and how to access it and things like that.
We got a question came in. What does partnering look like? Is there a formal process or agreement?
Yes, there actually is. So partnering can look lots of different ways. If you are interested in funding from us, then on our website we have we post our funding opportunities, and you can apply for different funding. We're constantly posting RFAs, but also one of the reason why we're very interested in working with you guys is really because we have experience working with homeless populations that have substance use disorder issues, and we know that there's a need. We want to serve homeless populations. Where we have a hard time is we're not able to get the medications to them because we don't have an address to send them. And so we're working on a mobile clinic, and that hopefully is coming. And hopefully when that happens, I'll be able to present to you guys about that. We can talk about the mobile clinic. But in the meantime, it would be great to have, if an organization had like a drop-in center, a day center, or a shelter, or somewhere where we could work together on developing access points to the clinic, and we would pay for, the cost of doing that. But it would just be really great to be able to have people have access to treatment right where they go anyways every day, or wherever it is that they utilize services.
All right. And with that, does anybody have any more questions before we hand off? We've still got a little bit of time for this section.
Yeah, Craig, this is Mary again. Hi, everyone. I just want to follow up with a few points to echo some of what Carla said and describe again why we wanted them to come and talk with you all. We know that substance use disorder treatment is a big need in our CoC, and not every community has access to substance use disorder treatment, and not every person who can't afford to pay for it has access. So when Carla reached out to us at Texas Homeless Network, we thought, wow, this sounds too good to be true, that there's an organization and a project that is helping people with lower incomes be able to have access to substance use disorder treatment services. And not even just that, but also, again, those non-severe mental illness issues or other healthcare issues. And people can get access through the telehealth clinic, but also you can have access points in your own community, either someone who's already providing substance use disorder treatments that this project can partner with and help to fund to maybe expand services, or if you don't have any services already, maybe your organization could be that access point where you offer a room and a chair and a laptop where a person could come in and access the telehealth clinic at your site. So just wanted you to also echo that you saw on the map, there are a lot of places that don't currently have Be Well Texas funded activity going on, and many of those are in our CoC. And so we wanted to give you the opportunity to talk with Carla and B about what might be possible to get going in your community. So I think we were going to have a time for Q&A. If anybody wants to type in a question into the chat, I think that is the way that we'll be able to ask the presenters your question.
Thank you, Mary. That's
Also,
great.
as they
That's
said,
true.
they have. Yeah. About that, I was just going to say that they do have, again, socks and lighters with the Be Well Texas information on them so that people can have that resource with them in writing. If you all want to have some of those goodies that you can hand out to people in your community to make sure that they know this information and how they can contact someone about getting treatment. Yeah, maybe let me ask a question. Some of the things that were guiding our discussion initially is like, do you know how many people that come to your agency could use substance use disorder treatment? Do you know how many people in your local homeless coalition that all those agencies serve could use substance use disorder treatment? Or how many people in your larger community could use access to substance use disorder treatment? Also, some of the organizations that they said they work with are federally qualified health centers or FQHCs. Those are community health centers that are in a lot of our communities. So they do a lot of partnering with those groups, as well as local mental health authorities or LMHAs. And I know there's one of those that covers every county in Texas. So if you would like to be a link between your local mental health authority, for example, and Be Well Texas, now you have the information to pass that along and maybe, again, get more substance use disorder services and mental health care services to the people that you serve in your community. So also one question is, how can Be Well Texas make it easy for you to get their services into your community to help the people that you serve?
How can Be Well Texas? Can you repeat that?
How can Be Well Texas staff make it easy for all of you to get their services into your communities? I'm asking the attendees, Carla.
Oh, okay.
So if you have some ideas about that you want to discuss right now, or if any of you are already in a community where Be Well Texas is operating and you want to talk about how it's going in your community, we certainly would love to hear that.
Hey, y'all, this is Jim with Teachin. Would it be possible to pull that map back up? Because I think that map was really helpful just to kind of see where Be Well is, and that might be helpful for this conversation as well. Thank you.
Yeah, so I'm looking. There are some places you'll see in the valley. Looks like maybe Laredo area, also Corpus Christi, um, kind of East Central Texas, up there in North Texas. Uh, Anybody from any of those communities that's on the call today that could talk about Be Well Texas in your own community? Marcia from Galveston asks, can we bring our addicted clients to Houston from Galveston?
I mean, absolutely. We don't have, it's a statewide initiative, so we don't have limitations related to where somebody lives. It is outpatient care. And so it depends what type of service you're looking for. But the Harris Center, for example, we have quite a few providers in Houston. Um, so it just would depend on what services were needed, but of course, absolutely.
And it may not even be necessary to have to transport the patient. For example, with the Be Well Clinic, the beauty in that is that so long as the patient is able to call from an office, it may be easier from an office of a case manager, to Carla's point, in case there is a need to get medication prescribed. So long as we have an address so that the medication can be mailed, that is sometimes where we hit a obstacle or a hiccup, because we don't have where to mail the medication for that patient. Once we have that and we have somewhere where that patient can go and have the privacy to have the one-to-one session with the provider, for example, from our Be Well clinic, then they can get the care they need from just going to an office with their caseworker, case manager, recovery support staff, their housing specialist, whomever that is. Key here is just that they have that privacy. And I mean, we do have providers across the entire state also that the patient could get linked to. So for example, if you have a patient that lives in Galveston and you would like to know what resources are available through Be Well, what providers do we have, you can send us an email and we can certainly provide you with the names of partners or providers that we have in the Galveston area, in Amarillo, in Lubbock. We just set up a contract with a office-based opioid treatment provider in Pampa, Texas, which I had no clue where that was at. But that's one of those sparse areas where the map is kind of, it doesn't have too many dots. Well, it's going to have a dot at it very soon. So we're waiting, for example, on 5 approvals from the state on OBOT providers. So we will have 5 more dots added on. So these, it's an ever-growing map that we constantly are adding to it. But if you have someone in an area and you want to know what services are available through Be Well Texas, you can email us and then we can tell you, well, there's recovery support services through this agency, there's medication assisted treatment, there's recovery housing. We can provide that information also if that is helpful.
Really, we thought we would build it and they would come, and we have found that in some areas it's been more challenging to I guess to link with those communities and to build a relationship. And so we are trying to connect with providers that we know are already embedded and already working there, to kind of see if we can figure out a way to meet the needs, whether it's directly or indirectly. It doesn't really matter to us, but working with people that are in those communities is really what we want to work on.
And this is Mary again. If someone in a community like Marcia in Galveston wants to learn more about how a provider in her community could join the Be Well Texas Provider Network or become an access point, should they also just email you?
Yes, absolutely.
Yeah, absolutely. And you know what I was thinking? I hope my contact information is on there, but should I type it in just in case?
Yeah, go ahead and type it in. And I think it was on the front. I think it was on the very first.
I'll put B's in there too.
It was, there you go.
But not really now, so that picture. And yes, any questions you may have, feel free to reach out to Carla or myself. I do work directly with the provider network, so onboarding and having conference calls with possible or interested organizations is something that we do on a regular basis. So yes, please feel free to reach out to either one of us, and we will follow up with email or setting up a conference call, whatever is most appropriate based on the request.
Maybe with the website, Carla.
All right. We have another question. Can we bring clients from Erath County to Tarrant County?
Yeah, yes,
Yes.
yes, of course you can. You definitely can. That's not a problem. Uh, like I said, we don't have limitations on county, but we can also help identify what providers are closest to that area.
And we do have providers in Tarrant County.
Yeah.
And maybe there could be an opportunity for you to get a provider in Erath County.
There you go.
So then you wouldn't have to take a client from Erath to Tarrant. So that's kind of one thing we were hoping to hear too, is that the more that people in Balance of State know about this project, the more substance use disorder treatment and related services we could get into Balance of State communities, so that you and the people that you're serving can get services right in your own county.
That's exactly right. You know, one example I can give you is we started with just one patient, and now it's turned into a relationship. And this isn't a formal agreement, but it was a primary care doctor in a very small town who found out about us through, I think, the FQHC. I'm not exactly sure. And he had a patient that needed treatment, and there was nothing in that area, and the provider didn't feel comfortable providing the treatment because he didn't know how. And so we arranged for the patient to receive the treatment at the primary care provider's office. So it's pretty cool because now the primary care physician is also involved in their care. And now we've set up a way for us to be able to provide that care indirectly through this primary care doctor. And so there's lots of ways that we can work with different communities, big, small, it doesn't matter. Really, it's just the idea of figuring out how to, what every community is so different. It's just figuring out what each community needs and what would work best. And you guys are in the best position to know that.
All right. Any other questions for Carla or B from Be Well, Texas? Well, let's see. Oh, Margaret is reminding us that if you missed some of the presentation due to sound issues, there will be a recording and the post-meeting materials sent out to attendees. And you can also review the presentation and the Be Well Texas brochures in the today's materials pod below. It's items 4 through 6. And you have Carla's email and B's email, so you can contact them directly to learn more. And we want to thank you so much for coming. We're really excited about the possibilities of getting more of these kind of support services out into our BOS communities. So thank you so much.
Thank you for having us.
Thank you very much. We really appreciate it.
All right. Well, we are going to go ahead and move along on our agenda to the section that we call Community Conversation. And this is a time where we want to give members a time to talk with us and talk with each other about things such as solutions to the challenges that you're having, examples of what's happening in your community that you want to share, ideas, best practices, that sort of thing. So We want to just ask you now, what kinds of things would you like to hear about in a community conversation time in future meetings? Again, how your community or other communities are addressing a challenge that you might be facing in your agency or in your community or with a specific subpopulation of people experiencing homelessness. And also, are there any things that you want to share about what's happening in your agency or your community? Things that are going well, or things that are maybe new in your community that you didn't have before and now you do? A partnership that you've developed that's something that you think other communities would benefit from hearing about. So, we have two poll questions for you. What would you like to hear from other communities? And what would you like to share with other communities? So, in the past, we've focused a little bit more on what we wanted to either talk to you about or what we wanted your input on. So, for example, the barriers fund that we had, that funding from the CARES Act, that we were able to partner with community agencies to provide some funds for people to help them obtain or maintain housing. We talked a little bit about your input on our newsletter, on our general meetings, on our strategic plan. And then we had guest speakers come in and talk about how their communities are using home art funding and how their communities are using emergency rental assistance funding. We also had a conversation one day about the statewide camping ban. So timely topics that we want to make sure we're staying current and talking about what you want to talk about. So let's see, I do see some answers coming in. What would you like to hear from other communities? Some answers are, what other funding streams are communities using other than CoC or ESG funds to resolve homelessness? That is a great question. Certainly could learn from that. How communities are addressing the availability of affordable housing units, longer wait times in shelters, or transitional group housing to place in longer term housing. Okay, so very, very much about needing more affordable housing on the ground. We are very challenged. The evictions are rising fast. We're open to suggestions. Okay, so just kind of generally, how are communities handling the rise in evictions? Did I understand that one correctly? And then anything that you want to share that is happening in your agency or your community that you think would be helpful for other people, like anything in response to those three needs above would be great. But also, if there's something else going on in your community that you think is a good idea, or how a best practice is being carried out, or some breakthrough that your community has had. I know with home art funding, maybe some of the other CARES Act funding, we were working with a lot of organizations and some communities that we hadn't worked with before. And so we've made new partnerships, and some agencies started doing new activities that they'd never done before. All right, well, so not seeing any more comments. Maybe we'll leave it open for a couple more minutes, because really we want to make that, again, that community conversation time something that feels meaningful to you and useful to you. So these are three really great ideas that we can aim for in the future. And again, if you have someone in your community that could speak to any of those in particular, please let us know. Or if there's someone else in your community who's not here with us on the call today that you want to pass this information along to, they can always contact us, any of us at THN. Our email addresses are our first name at thn.org. You can always also just have them contact me, Mary, Mary, at thn.org, and I can get them connected to someone who can help. All right. Well, I think we'll go on to the next item, which is a time for any of you to address the CoC. So talking about anything at all that you want to. Oh, and actually, sorry, I just now seen this chat. We've been developing a mental health court in partnership with the task force as a result of SIMS intercept mapping we've done in our community. Okay. So that may be something that you'd want to share and talk about in a community conversation as the development of a mental health court. And I'm sorry, I don't even know what SIMS intercept mapping is. So that would be a learning opportunity for me too. Thank you for that. We will definitely make a note of that. So again, is there anything that anybody wants to bring up with, oh, thank you, Craig. Put a link to a samhsa.gov SIM overview. Sequential Intercept Model, or SIM, details how individuals with mental and substance use disorders come into contact with and move through the criminal justice system. Very interesting. Okay. Love to hear more about that. Anything anybody else wants to talk about? If not, we will go ahead and move on to announcements. We are going to vary from the agenda just a bit and talk about the CoC program competition first, and that is with Jim Ward, our director.
All right. Thanks, Mary. I just want to make sure everyone can hear me okay. And I'm going to be working from, it's actually item number 6 in the resources web links pod. So that's below the chat, close to the bottom of your screen. You'll probably have to scroll down. And Craig, I'm just going to share my screen if that's all right. Looks like I see you're uploading content. So folks should be able to see the introductory page of a PowerPoint, and what I'm here to talk to y'all about is the Continuum of Care program competition for fiscal year 2022. I recognize and want to just acknowledge in the chat that a Continuum of Care program funds are not the only resources that a community must leverage to end homelessness, but they are and remain a really critical point for a lot of communities. And so if you're unfamiliar with the Continuum of Care program competition, we're going to talk about it a little bit here. And really, I just want to kind of walk y'all through. This is only going to be about 5 minutes, maybe a little bit longer, because if you know me, you know I can be a little long-winded. But the idea is I just want to talk briefly about the Continuum of Care program, about the Continuum of Care program local application process, and some upcoming important dates for fiscal year 2022, and then talk briefly about what applicants can expect during the competition, and then provide y'all with some next steps. So I'm not able to see the chat. So Craig, if you could just announce if there are any questions, that would be super helpful. So folks are probably at this point familiar with the Continuum of Care. When people use the term Continuum of Care, they could be talking about a variety of things, but what I'm talking about it today, I'm talking about it in the context of the funding stream that HUD allocates on an annual basis to communities all around the United States. So the Continuum of Care program has 4 kind of primary objectives. And what we're going to talk about today is funding to quickly rehouse homeless persons and trying to stop the trauma that's associated with homelessness and begin to recover from that. So just briefly, the Texas Balance of State CoC is directed by the CoC Board of Directors. There are 16 directors all around the Balance of State that have a specific focus area. So THN staff that are working in the Balance of State take our lead from those folks. They determine the policy direction of the CoC and ensure that we fulfill our responsibilities, such as the point in time count, housing inventory count. Another one of those responsibilities is that we host this competition to recommend applications to HUD for CoC program funding. So you've all seen this orange map. You know that there's 215 counties in the Balance of State. If you don't know, now you know. But the CoC program competition covers everywhere there's an orange on this map, and so it's a pretty wide geography, and we do our best to kind of accommodate all of our partners in various locations around the state. So, as I mentioned, THN is the collaborative applicant for the Balance of State. So what that means is not only do we kind of run this competition process, but we also interface with HUD as it relates to the competition process. And so we submit both the results of our kind of local competitive process, but then also something else that's called the CoC application that most folks on this call won't engage with a ton. But something that's important to know is that we do post that prior to submitting it to HUD. It'll be posted on our website. Generally, that's a minimum of 2 days prior to submitting it to HUD. But there's a lot of really useful information, and you can kind of get an idea about HUD's priorities by reviewing the CoC application. And also, we run the HMIS system for the Balance of State. We use Client Track here. That does not mean necessarily that your organization must be in HMIS to administer CoC program funds. You may be in what's known as a comparable database, depending on your agency's mission statement and target population, specifically those providers that target and serve survivors of domestic violence as a primary focus of the organization. So I kind of alluded to this competitive application process. And so first of all, I recognize that I'm trying to cram way too much information into this short presentation. But just know that the CoC program in general will fund housing interventions, right? That's the whole purpose of the CoC program, is to get people housed. And so primarily it funds rapid rehousing, which is a time-limited housing intervention, and permanent supportive housing, which is a non-time limited intervention. And it also funds a couple of other projects that are a little more obscure, called the Joint Transitional Housing and Rapid Rehousing Component Project. Just know that it combines rapid rehousing and transitional housing. And there will be a ton more information about the housing interventions as we kind of move along in this process. But the process itself is something that I wanted to bring the members along with for this conversation. So typically the way that this works is THN will publish what we call an intent to apply. And so the intent to apply is basically where someone raises their hand, metaphorically, to register their interest in participating in this process. And so that will happen typically, it depends, right? HUD doesn't release their request on the same day every year. So it happens, broadly speaking, between the months of June or July, all the way, it could happen as late as August. Last year, HUD released their notice of funding opportunity on August the 18th. And so our intent to apply is really just to try to get a scope of how many people are interested in the Continuum of Care program for a given year, because it helps drive our response to that interest that we see. And so That intent to apply is something that happens all digitally. It will happen via a competition portal that I will talk about here in just a moment. But following that intent to apply, HUD will release the notice of funding availability. That should actually say funding opportunity, but they change it so frequently that I can't keep up. So that notice of funding availability is where HUD lays out the specific conditions that must be met for that particular year's funding cycle. And so sometimes that'll be things like they'll only fund new projects for this target population, or they'll only fund this much, potentially fund this much new. There will only be a limited amount of new funding available for applications. But it's where the specifics of this process come out. And so when that notice of funding opportunity comes out, THN staff monitor, or we're monitoring for it on a daily basis, even now. But when that notice of funding opportunity comes out, we really quickly synthesize the information that HUD is communicating and asking for, and then incorporate that into what we call a request for proposals. That request for proposals is kind of what kicks off the formal application process, if you will. At that point, applicants that registered their intent to apply would have access to the full project application. And that full project application, depending on the project type, will look at a variety of different things. Everything from how did you determine the need that existed that this project application is hoping to solve, all the way to engaging folks with lived expertise in the decision-making processes at your organization, to policies and procedures, and fidelity to this idea of housing first. So the full application is it's a complex process, and I'm not going to go into that today, but I'll tell you where you can learn more before I stop talking. And so following the full application process, THN staff will do what we call threshold and quality review to ensure that all applications that we've received, if we recommended them to HUD, would HUD be able to fund those projects, right? So we're looking at things like, are you registered for the system for award management, for example? Does your organization have a unique entity identification number? Is anyone at the organization or any known actors at the organization barred from doing business with the federal government? Things like that. And then further, we look at the details of the project to determine whether or not the proposed activities would be eligible for reimbursement under the CoC program. And so that threshold and quality review process is an interactive one. So we review, and then if there are deficiencies that we identify, we ask applicants to correct those and then send the applications back. Process happens over the course of a couple of weeks generally. And then following that kind of cursory review by THN staff, we send the applications to an independent review team. The independent review team is a group of CoC stakeholders just like yourselves. We do target this opportunity to folks that are providing direct services and also folks with lived expertise in homelessness. And we compensate folks for their time reviewing applications. I will say that no one is making a living on reviewing applications for the independent review team. I think the reviewers are compensated at a rate of $75 per application. But that's a really important part of the process, right? Like, we don't want THN staff making the call about how the quality of a applicant's response. And so following the independent review team's review, those applications will come back to THN. We'll do a presentation with the CoC board following the ranking of those applications. And then the CoC board ultimately will select the applications that are included in the order in which those applications are included and announce that to the CoC. And then once all that is done, we have one final thing to do before we can take a breath, which is submit all of that information to HUD. This whole process that I just described happens over the course of about 90 days. I'm not going to spend a whole lot of time talking about the CoC program requirements. Just know that it is federal programming and it does come with federal requirements. This is not an exhaustive list, but applicants or recipients are expected to document eligibility. Obviously, they are expected to use a comparable database or HMIS. They're expected to participate in coordinated entry. They're expected to submit their annual performance reports on time. They're expected to adhere to the interim CoC program interim rule in full, and any other applicable regulations such as a CPD notice or a community planning and development notice that would be issued by HUD. And in addition, there is a Texas Balance of State CoC standards and expectations form that all applicants selected for funding agree to and is maintained on file at THN, just so we're all kind of on the same page. And I think the last thing that's on this bulleted list should be like one of the first things. Like CoC program recipients play a really active role in a community's housing crisis response system, right? For a variety of reasons, but one, generally these organizations are very visible in the community. They are really active in the local homeless coalition. They are, sometimes spearheading or participating heavily in the point in time count. So we really look for CoC program recipients to play an active role in the local homeless coalition. Now, that's not in the expectations form necessarily. Some of that stuff is, but in general, organizations that administer these program funds are very active in their local response system. So I want to talk a little bit about important dates for this year's CoC program competition. So on 6/24, so June 24th, I guess that's 2 Fridays from now, we are going to hold an interest webinar. So the interest webinar is kind of going to go in depth into some of the stuff that I just skimmed the surface on today, and will be an opportunity for folks to ask nuanced questions about the CoC program, but it will also signal the opening of the intent to apply for this program cycle. That intent to apply will open and stay open from 6/24 all the way to the day after Independence Day, so July the 5th at 11:59. And then at that point, we'll wait for the full application and the RFP to open at some point to be determined. So again, the purpose of us doing the intent to apply at this point is to gauge interest so that we can right size our response to the interest that exists. But if you are interested in applying for the CoC program, I would highly encourage you to attend the interest webinar. We don't hold people to the projects that they register their interest for necessarily, but the idea is that we need to know in advance whether or not this is something that you're interested in, and so all that will happen a little bit later this month and move into early July. So you might be thinking, Jim, I have no idea about the CoC program. I don't know what rapid rehousing is. I've never even heard of permanent supportive housing. What support can you offer me? The good news is that right now, THN staff, primarily myself and the CoC performance manager, Hope Rogers, can offer individual project level technical assistance, meaning we can help you think about what your project design would look like. We can help you think about whether or not what you're thinking about is even eligible for reimbursement under the program. But as soon as that notice of funding opportunity is released, all of that must stop. So that's not a requirement of the program. That's something that we offer to applicants, whether they take us up on it or not. That's up to them. However, for new project applicants, there is generally there will be a requirement that new project applicants engage in a 30-minute technical assistance session with THN staff, just so that we can make sure before you go all the way through with this process that what you're proposing to do is eligible and that you have a solid understanding of the requirements of the program. In addition, there will be competition question and answer webinars where applicants can come during the application period and get their questions answered about the platform, about the NOFO, about the RFP. And we also will publish a frequently asked questions document on our website. So our webinars are recorded and will be posted to the THN website. There is a competition landing page on thn.org. I'm not going to navigate us there because I've been talking for a long time, so I'm going to keep moving. But just know that all that exists, and it's in the Google Doc that is linked in the today's web links or resource web links pod. For context, I've linked here the 2021 CoC program competition materials, a way for you to sign up for updates about this process. So for the 2022 competition, you can follow this link here, this everyaction.com, and get signed up for updates from THN staff. You won't miss a beat, if you're signed up on that competition listserv. And then the final bullet point here is the CoC program interest webinar registration link. Registration is pre-registration is required for the interest webinar. The interest webinar itself is not required. So highly encourage you, if you're interested, to sign up for CoC competition updates. Again, that intent to apply form when it opens must be completed by July 5th. If you're a renewal project and you're thinking, Jim, we haven't done the GIW yet, we will. As soon as it's released, THN staff will get the grant inventory worksheet out. And then again, highly encourage you, if you're interested in the CoC program, to contact myself and Hope to talk more about what you're planning to do or what you'd like to do with these funds, just so that we can help you the best way that we can. Questions, if there are any. I realize I just talked at y'all a mile a minute for a good
No
15
questions came
minutes.
through so far. I did put the blurb up about the webinar, its registration link, and I added it to today's materials. It is now number 8.
Oh,
But
cool. Thanks, Craig.
uh-huh.
Yeah, I'm just going to go ahead and put my email in the chat, and then I will actually, barring any questions, I'll monitor the chat for questions, but if barring any questions now, I'll pass it to Daphne for the CoC board update.
Hello, can you all hear me?
Yes, ma'am.
Alrighty, well, good afternoon. My name is Daphne Adams, and I'm the current board chair for the Texas Balance of State CoC. Here's what I have for April and May board activities. In April, the board welcomed 2 new members, Dee Ross, a Deputy Executive Director of the Housing Authority of the City of Victoria in Seat 11, and Nora Vargas, Homeless and Housing Services Manager at the City of Corpus Christi in Seat 10. In May, the board voted to approve updates to the CoC board requirements policy that describe the changes previously approved in February through a board action request. The policy updates describe a 16th board seat that will be filled by a member of the Youth Action Board. And the Youth Action Board is still in development, so you'll hear more about that later.
All right. Thank you, Daphne. The next announcement is about the CoC board. As Daphne said, she is the current president of the CoC board, and that's our group that makes decisions on behalf of the CoC. There are currently 16 seats, and the even numbered seats will be up for election this fall. So we are later this month and into July going to be recruiting people for running for these seats. You'll see this in the announcements section of the agenda. You'll see seats 2 through 14 and their designations. So if you are a member of that group, for example, you are a veteran who has currently or formerly experienced homelessness, you could run for that seat, seat 2. Or if you work with veterans and their families who are experiencing homelessness, you could also run for seat 2. So there are 7 seats up, and then seat 16, as Daphne said, will be filled by a member of our currently in development Youth Action Board. So just wanted you to know we will be recruiting soon and opening that up for nominees. If you or someone you know you think would be interested, pass along that information. Thanks.
Yeah. This is Margaret Hill, governance coordinator. And I wanted to tell you all about another couple of opportunities coming up. We have so many opportunities for people to participate, so I hope we get some of y'all on board for this stuff because we really, really would appreciate it. Um, we're looking for people for our persons with lived experience work group. Uh, and that is available. The recruitment information is available on our website. And I just put a link in the chat to that. There's a whole document with and more information about that. It is a position that will be compensated, and we are looking for people with current or recent experience of homelessness. I believe the definition for that was within the last 7 years. So anybody here, or if you know people that have recent experience of homelessness that you know who'd be interested in that opportunity, please pass that information along to them. Um, I will say also that we are having a orientation meeting. I mentioned that at the beginning, but I'll mention it again on June 15th, which is a week from now. And there is also some more information about that at that same link that I put in the chat. And we encourage anybody to come that wants a little bit more detailed information about the balance of state. And I believe also that there's some information about some other opportunities on that page as well, if you wanted to check it out. And then I will let Katie Martinez finish up our announcements for today.
Thanks, Margaret. So I have a super quick announcement on the Coordinated Entry Steering Committee. So there are currently openings for lead coordinated entry roles in 4 Texas Balance of State CoC coordinated entry regions. Those are Galveston, Lubbock, Odessa, and San Angelo. So we're looking for somebody with an understanding of coordinated entry to volunteer as the point person for coordinated entry in those regions. This individual would serve as the lead for their local coordinated entry planning entity that manages the day-to-day operation of coordinated entry in their region. This person would also serve as their region's representative on the Coordinated Entry Steering Committee that governs coordinated entry at a CoC level. Representatives for these planning groups are asked to commit to 1 year in the role, and they can expect to participate in monthly coordinated entry steering committee meetings and can also expect to lead their region's monthly coordinated entry planning entity meetings. If anybody is interested in learning more about these 2 planning groups or about the specific responsibilities that this representative would have, please reach out to the Systems Change team at ce@thn.org for more information. Thank you.
Thanks, Katie.
Thank you, Kate. Can I interject in here real quick? Just to sum that up, because I feel like we just threw a bunch of opportunities out for people. So that's just to summarize all that we're looking for. People for the independent review team, for the Youth Action Board, for the CoC board, for the Persons with Lived Experience work group, and also for the Coordinated Entry Steering Committee. So please reach out if you have questions about any of those things, or check out our website. There should be more information on there.
Yeah,
Alrighty,
this is Mary. I want to point out that Marlisa wrote a comment in about the Youth Action Board. It's a paid advisory group for youth with lived experience with homelessness, juvenile justice system, and or foster care system. If you know anyone ages 16 to 24 who lives within the Texas Balance of State CoC and has lived experience with the systems listed above, email Marliza, that's MARLIZA, at thn.org. And with that, I believe we are done with our formal agenda for today. Again, I refer you to the written agenda about how you can become a member of the CoC, which just basically means you live or work in the CoC and you want to participate in our activities. We also have the email list where you can sign up to receive emails with important information, including our newsletter. There's a link to our website, THN's social media. We also have some committee updates. We do have a number of committees that work in the CoC to guide certain activities, and you can find out more about what they've been doing and how to join them. Also, we are going to stay on the call for about 15 minutes afterwards. The staff will. So if you want to talk to somebody one-on-one or you with all of our staff with something that you want to ask about or tell us about, feel free to do that after the meeting ends. And we do so appreciate you joining us today. We know that there are a lot of things that take up your time, and we appreciate you giving some of it to us so we can have a robust meeting. So thank you all, and I hope you have a good rest of the week.
Mm-hmm. All staff that are on the call, your mics are live if you want to come share your mic and your camera. All today's materials have been uploaded 1 through 8 in the bottom left. Feel free to download those. We will send out the recording as soon as we can. All right, we are right at 3:30 and I'm not seeing any questions. I'll give it just about 1 more minute for you to download and we will shut today's meeting down.
And staff, if you want to participate in our post-meeting conversation, we will be starting that at around 3:45. There is a calendar invitation. Hopefully you got it. If you didn't, let me know. We can get it to you.
Sounds good. All right. I am not seeing anything, so I'm going to go ahead and call it. Thank you again for joining us today, folks, and we will see y'all August 10th.
Okay,
Wait,
I'll see y'all at
almost cut off
3:45.
Marcia. All right.